Good morning, everyone, and thank you for joining this briefing about the Colorado Pulse poll with a focus on what we heard from Coloradans this year about their health and well-being. My name is Kyle Rojas-Legwider, and on behalf of the Colorado Health Foundation, I want to welcome you to this briefing today. We're really excited that you're here to join us. We have a lot of information to share with you, and we're going to start with just a few housekeeping announcements about the format of today's webinar. You'll notice that your screen is blank, but that does not mean that you are not a participant in this conversation. We do want this to be an active conversation with you as we share a lot of data and a lot of information about what we heard from Coloradans this year in the Colorado Pulse poll. So please do feel free to use the chat throughout today's event to share your questions, to share your comments about what you're hearing, because we will have an interactive question and answer session at the end of today's briefing with the panelists that you'll be hearing from today. Closed captioning is also available for today's webinar. To activate that, please click the caret next to the CC icon in the Zoom toolbar at the bottom of your screen and select Show Subtitles if you would like to see closed captioning. And also, we are recording this briefing. We're making it available on the Pulse website to everyone, and the slides will be available there too. So feel free to sit back, relax, absorb the information at your leisure today, and know that you'll have the opportunity to come back to everything that you see here again in the future. So you don't need to be furiously scribbling notes in the background as you do so. I'd like to start with just a quick bit of information about the Colorado Health Foundation, in case you're not already familiar with the foundation. We are a statewide foundation in Colorado that exists to serve a vision of making sure that our state is a place where we can all say that we have what we need to live healthy lives. To do so, we invest in communities across the state of Colorado and incredible organizations doing incredible work to improve the health and well-being of their communities. We advocate for changes, and we do a lot of community engagement and listening to really understand Coloradans and what's going on in their lived experience on the ground in the different corners of our great state. And in all of those things, we are pursuing a North Star of creating health equity in Colorado for the people who live here and call Colorado home. One of the ways that we do that last piece of listening and understanding the experiences of Coloradans across the state is through our annual Colorado Pulse poll, which is what we are gathered here today to talk about. Pulse is an annual poll now in its third year in which we ask Coloradans across a broad range of issues about things that they're experiencing in their day-to-day lives. We cover a wide variety of topics, and we talk to a lot of people in Colorado. And we really think of this as an active listening, hearing from people outside of our own immediate circles to gain a greater understanding of what life is like in different parts of Colorado for different people in Colorado, and to understand the patterns that we can see across people's experiences of where we have shared experiences in our state, shared concerns, shared priorities, and where our experiences may differ based off of who we are, where we live, and other aspects of our lived experience and identities. As a part of the Foundation's commitment to racial justice, we're sure every year to oversample African Americans, Asian Americans, and Pacific Islanders, and Native Americans, so that we're able to report what we hear about this broad range of questions and topics that we explore in Pulse by race for every single question. And before we dive into what we heard this year with a focus on the questions that we asked specifically about mental health, substance use, and healthcare, we want to acknowledge that we can't get to this really nuanced look at people's experiences in Coloradans on our own, and we do so in partnership with a number of organizations and a number of community partners, particularly to achieve that oversample of Native Americans in Colorado. So we want to thank the individuals and community organizations listed on the slide for helping us this year to gather data that can help us to reflect the experiences of Native Americans in our state as well, which is a rare opportunity for us that we're excited to share with you today. I'm going to turn it over to some of our other partners in this work now, Dave Betts and Lori Weigel. Dave is from FM3 Research. Lori is from Newbridge Strategies. They are the leads of our bipartisan polling team who conducts the Pulse poll on our behalf for the last 3 years. And Dave is going to start out with a look at the methodology of how we gather this information and what that looked like this year. So Dave, take it away.
Great. Thank you very much, Kyle, and thanks to everybody for joining us today. We're very pleased to be able to present the latest round of results of this year's Pulse survey. We want to just talk a little bit about the methodology of the poll and the steps we take to ensure that it is as broad and representative of all Coloradans as possible. The data that you're seeing come from interviews with almost 3,000 Coloradans from across the state. We draw random samples of residential addresses across Colorado, match that data to obtain landline phone numbers, wireless phone numbers, and email addresses, and then invite people to participate in the survey through telephone calls, both landline and mobile, invitations that are sent via email, via text, and also by postcards to addresses for whom we have no other contact information. We do the survey in English and Spanish to ensure that that language barrier does not preclude participation. And we do the interviews over roughly a 3-week period, in this case during the month of April, to make sure that we have the opportunities to be persistent in reaching out and calling people back and inviting them to participate in the poll. As Kyle described, we oversample Coloradans of color. And when we get the data back, we weight them according to census data so that the results reflect the true population distribution of all of the different racial and ethnic groups that are included in our sample. In addition, the reason that there are 2 pollsters on the call today is that we represent a bipartisan team. My firm, FM3 Research, when we poll for candidates, only polls for Democrats. My colleague Lori, who you'll hear from in a moment, when her firm, New Bridge Strategy, polls for candidates, they only poll for Republicans. But the 2 of us have been working together for nearly 20 years in a variety of capacities, doing bipartisan research, both designed and analyzed from a bipartisan perspective on a range of public policy issues like those that we explore in Pulse. So that gives you a sense of who we talked to and how we did it. You'll see there's a number of places in the data where we also talk about geographic distinctions. We've divided the state into 6 regions, as you'll see on this map. We have the Denver metro area, we have the Eastern Plains and the Western Slope. We separate Larimer and Weld counties in north central Colorado as their own region. And then we have, because of our oversample of Coloradans in Pueblo County, we have enough respondents in both El Paso County and Pueblo County individually to highlight those in the data as well. So there's a number of places where you'll see us draw some geographic comparisons using the regions as they're defined on this slide. So with those preliminaries, let's go ahead and talk a little bit about what we learned. And for that, I'm going to hand it over to my colleague, Lori Weigel.
Great, thanks, Dave. So first of all, we're looking at concerns about health and well-being. And one of the things that we discussed in our previous release was that cost of living, cost of housing, cost of virtually everything has become a concern for Coloradans. And the cost of healthcare is really no different. So we have 2/3 of Coloradans telling us today that the cost of healthcare is either an extremely serious problem or a very serious problem. Almost all Coloradans are telling us it's at least a somewhat serious problem as well, but 2/3 really sort of have an intense response telling us that it's an extremely or very serious problem today. That's not the only concern that Coloradans have related to health. We also had nearly the same number, 63%, telling us that they felt mental health was an extremely serious or very serious problem today. And virtually everyone, again, telling us that it's at least somewhat of a serious problem. On the next slide, and somewhat related to this, we also saw that drugs and alcohol use is something that a majority of Coloradans are again telling us is an extremely or very serious problem at 58%, defining it as such. Now, those issues have been something that we have tracked over time. So starting in 2020, we asked about drug and alcohol use and also mental health. Both of those saw an increase last year, but in just 1 year's time, and we've seen a subsequent increase in a couple of these as well since last year's poll. So we've seen an 8-point increase in just the last year in those defining drug and alcohol use as an extremely or very serious problem. The cost of healthcare, right at the margin there, a 2-point increase. Mental health has remained stable, although again, that saw an increase between 2020 and 2021. So all of these sort of either stable or seen an uptick in levels of concern among Coloradans. On the next slide, you can see that those concerns really cut across racial and ethnic lines. We see that white respondents, Asian Americans, Native Americans, we're really seeing concerns about the cost of healthcare being a significant concern, mental health as well. We have a majority of each of these subgroups defining that as an extremely or very serious problem. And same thing with drug and alcohol use, a majority for most of these groups really telling us that these are very serious problems facing the state. On the next slide too, you can see that that cuts across regions of the state, although there's some interesting distinctions here, and it may just be how people are responding to these different characteristics. The Eastern Plains and Pueblo, we saw very significant, nearly 3/4 telling us that drug and alcohol use is what they would define as an extremely or very serious problem. In other regions of the state, we saw those more likely, those two regions less likely to say mental health is an issue, but higher among Colorado Springs, Larimer-Well, Denver Metro, at majorities in all these different regions saying that mental health is a concern. And certainly cost of healthcare is not exclusive to the metro area or even the Front Range. It's really across the state. The respondents are telling us that that is an extremely or very serious problem. And notably, the cost of healthcare is not exclusive to lower income respondents either. We saw 2/3, even in the highest income category, telling us that the cost of healthcare is an extremely or very serious problem, and really modest distinctions based on income, whereas on some of the things we talked about in our last release related to cost of living or cost of housing, where we saw more dramatic distinctions. This one really cuts across all income levels, as does concern about mental health and drug and alcohol use. So not exclusive in any means based on income levels. And then finally, as with most things on which we poll, there are some partisan distinctions that are somewhat intriguing. The cost of healthcare is more likely to be perceived as a concern, is more likely to be perceived as a problem among Democrats and those independent respondents than it is among Republicans. We see a fairly dramatic 24-point distinction in terms of mental health, where Democrats 3/4 are telling us it's an extremely very serious problem. But on the flip side, we see Republicans more concerned about drug and alcohol use by a 10-point margin between Democrats and independents. Still, majorities across party lines are really telling us that each one of these is an extremely or very serious problem facing the state of Colorado right now. So in terms of healthcare, we wanted to look at not just what's a problem, but in terms of worries and how this is personally affecting respondents throughout the state. So in each of the last few polls, we have asked about how worried they are that they or someone else in their household will be without health insurance coverage. And we had about 1/4 during the pandemic and last year telling us, yeah, that's something that they are very or at least somewhat worried about. That has increased dramatically in just the last year, up 10 points. Now we have 37%. So more than 1 in 3 Coloradans telling us that they are very or somewhat worried that they or someone else in their household will be without health insurance coverage coming up. And obviously a really dramatic increase over the last year alone. Now that does predictably have some real distinctions here, given our health insurance system being often tied to employment. So those who are not employed currently, a majority express concern that they or someone else in their household will be without health insurance coverage. But notably, even among full-time working Coloradans, we see 37% expressing worry about this. So really significant across the board. We also see it higher among people of color in the state, nearly half telling us that they are worried about this. And it's not limited just to this. This is one area where we do see a distinction in terms of income level. On the next slide, you can see that a majority of those in the lowest income lowest income category are telling us that they're worried. That drops fairly significantly once you get to the highest income category. We also have almost half of immigrants and nearly half of those who speak a language other than English in their home that are telling us that they are worried that they will be without health insurance coverage. So we also asked about a different aspect of healthcare in the state and asked respondents, this was part of a larger battery, but asked them, had they or someone they know been treated unfairly as a result of their race or ethnicity when seeking healthcare services? And we had 1 in 5 indicate that they or someone they know had been treated unfairly when seeking healthcare services. Not surprisingly, it was higher among non-white respondents. So we saw 27% indicating that people of color in the sample indicating that they had experienced that or someone they know had, but notably nearly 1 in 5 white respondents also said that. Native American and Indigenous, we saw nearly half telling us that they or someone they know had been treated unfairly in this particular case. We also saw that this is having real consequences. Some of these concerns about cost and the worries about that are really having a significant impact on people's behavior. So the last 2 years, we have asked them, have they postponed medical or dental care in the last 12 months? And we've seen an increase. So it was not an insignificant 39% last year that told us that they had postponed medical or dental care. That's up to 45%. So closing in on a majority of Coloradans that are telling us they have postponed medical or dental care in the last year. You can see on the next slide, there's some different subgroups and it could be a wide variety of factors that are driving this. Not shockingly, 65% of uninsured Coloradans are telling us that they are, and many that are worried about not having insurance in the future are telling us that they have postponed care. But a variety of other factors also bear a strong relationship. We saw nearly 2/3 of those who say they've experienced or know someone who's experienced unfair treatment when seeking healthcare or postponed medical or dental care. And it bears a strong relationship to some other coping behaviors due to the rising cost of living in the state, where we have over 3/4 of people who've skipped meals because they couldn't afford food, also telling us they postponed medical or dental care. On the next slide, we also see that LGBTQ respondents and those who live with a disability are far more likely to tell us that they postpone medical or dental care, and those who are without employment right now, 65% of those have told us that they postpone medical or dental care. So some really dramatic changes in terms of how people are coping with some of these worries. And Dave's going to pick up and talk a little bit about mental health now.
All right, great. Thank you, Lori. So one of the things that we've tried to explore in greater detail throughout the Pulse surveys is not just physical health, but mental health, because we know both that it has sometimes been neglected in past opinion research on healthcare issues, and also, especially during the pandemic, that there have been increasing mental health strains that many Coloradans have faced. This year's survey certainly confirms that dynamic. When we asked people whether in the last year they have experienced mental health strains like anxiety, depression, loneliness, or stress, a resounding 61% of Coloradans tell us that they have. So the overwhelming majority have experienced some kind of mental health strain. As you'll see on the right-hand side of the slide, there are certain segments of the population that are disproportionately likely to have had that experience, with more than 7 in 10 Coloradans who are identifying as LGBTQ, Native American, either uninsured or insured through Medicaid, lower income households, those who live with a disability, and younger Coloradans as well, those under age 30, as well as women in particular under age 50, all disproportionately likely to have to report having experienced some of these kinds of strain. Now, we have seen in past Pulse surveys that many of those who do experience mental health challenges have either been unable or haven't even pursued the opportunity to get help because they see a number of barriers to getting mental health care. So to explore that in greater depth in this survey, for the 61% of Coloradans who told us they had experienced such strain, we asked them to indicate how great a barrier a variety of factors might be in obtaining mental health services. On this slide, you're going to see the proportions that rated each of them either a major challenge, a minor challenge, or not a challenge. The dark green bars on the left are those who rate each item a major challenge. And then you'll see the total of the major and minor running down the right-hand side of the slide. The one that jumps off the page, of course, is the top concern. The services were too expensive out of pocket. So the cost of mental health care goes hand in hand with the broader concern about health care that Lori described earlier. But obviously, when there's a situation where, for many Coloradans, their insurance won't cover mental health services or won't adequately cover them, it means more out-of-pocket costs, and it means that becomes an even greater barrier. The second item on the list is the lack of available appointments or too long of a wait to get services. Almost a third rated that as a major challenge, and about 3 in 5 said it was a barrier to them obtaining care. And there's a range of other items as we move down the slide where you'll see roughly half or slightly fewer indicate that these items pose barriers as well. So there are multiple obstacles that Coloradans see to getting the mental health care that they may need. And strikingly, those barriers tend to cut across most major segments of the population. Given the prevalence of concern about costs, we might suspect that it is primarily those in lower income households that might be facing that barrier more often. But in fact, it cuts across income levels. Not only do 71% of those who have incomes under $30,000 per year find the cost of mental health services a barrier, so do 64% of those with six-figure household incomes. So that concern is one that is hitting the affluent, the middle class, and lower income households in pretty close to equal proportions, as is the wait for services and lack of access to services. Very few income distinctions on that concern, and frankly, on most of the concerns here. It's just, it's something that is experienced by Coloradans of all income levels who are experiencing mental health strain. Similarly, when we look at it by the type of insurance people have, yes, it is the case that for those who are uninsured, they are the ones who are most likely to view cost as a barrier, 77% labeling it a major challenge. But even among those with employer-provided health insurance, it is 70% who indicate that it's a barrier. In fact, it is those who are publicly insured through Medicare or Medicaid that are least likely to say cost is a major challenge, although it is still a solid majority in each case that does. There is also relatively little difference by insurance status for most of the other barriers that we tested here. When we look across the results by race and ethnicity, again, the story here is more the similarity of responses than it is the differences between them. There are a couple of places where we see that Native American and Indigenous Coloradans stand out in terms of perceiving greater barriers from finding a mental health care provider who understands their background and experience, and also more reservations about having to disclose too much personal information as part of a conversation with a mental health provider. But aside from those two concerns, in most cases, the responses from different racial and ethnic groups are pretty similar in terms of the barriers that they perceive. And again, the same thing is largely true as we look across the regions of the state. For residents of the Eastern Plains and up in Larimer and Weld counties, slightly higher numbers who report having to disclose personal information is more of a concern for them. And availability of services, a little bit more of a concern in Colorado Springs and Larimer Weld than it is in the balance of the state. But again, the rank ordering of these concerns is largely consistent across geographic regions and really reflects the fact that challenges to finding mental health care are prevalent across Colorado. They are somewhat more prevalent for those who live with a disability. You'll see here a number of categories where those who indicate that they live with a disability are substantially more likely than those who do not to report encountering some of these barriers. In fact, everything other than cost and basic access to services Those with a disability indicate more of a challenge in each of those respects in finding care than do those without one. So given the prevalence of concern about this issue, we tested a range of potential solutions that might be put in place to try to address it, and asked our respondents to rate how effective they think each of these approaches might be. And there is overwhelming consensus around pretty much everything we proposed here, with 3/4 indicating that each of these steps would be effective, and basically half in each case indicating that they thought they would be very effective. I think this is really just reflecting a lot of pent-up desire to see some action to help Coloradans get access to mental health care. So whether that means more options for people to access it near where they live, requiring insurance companies to cover it without co-payments, or pairing mental health professionals with law enforcement to respond to mental health emergency calls, each of those is pretty warmly embraced by Coloradans as something that might help to make these challenges a little bit better. And to a remarkable degree, those perceptions are bipartisan. We often see big divides on a lot of policy proposals across partisan lines, and while there are partisan differences here, with Democrats tending to be more supportive than Republicans, in each case we have overwhelming majorities across party lines believing that these steps would be effective in helping to address some of the challenges Colorado faces with mental health care. Also, when we look at these approaches by geography, very consistent responses here, solid majorities in each region of the state pointing to all 3 of these approaches as ones that they think would provide meaningful help. So that takes us to the deeper dive on the third of the 3 healthcare topics that we focused on here, and that is alcohol and drug use. Lori highlighted earlier how there has been a 13-point increase in the proportion of Coloradans rating alcohol and drug use a very serious problem over the 2-year period since the first Pulse poll. When we asked our respondents to indicate whether the amount of alcohol or drugs they consume has increased, decreased, or stayed the same, we do see that 13% tell us it has increased. Now there's a larger group, almost twice as large, that indicate that it has decreased. Some of that may have to do with emerging from the pandemic, people not being as home as much, and their patterns of substance consumption changing as a result. There still is a substantial subgroup that reports increasing use of alcohol and drugs. And we also asked our respondents to tell us if they ever felt worried about the amount of alcohol or drugs they consume. Just over 1 in 10 tell us that yes, they do worry about it. And you'll see on the right-hand side the subgroups that tend to express the greatest worry. Very similar, interestingly, to the proportions that were reporting mental health challenges at greater rates. They tend to be LGBTQ Coloradans. They tend to be Coloradans under age 40, Native American and Indigenous Coloradans, those who live with a disability, those who speak a language other than English in home, and Black and African American Coloradans as well. So in terms of steps that might address alcohol and drug use, we again offered the respondents a list of some options and had them rate how effective they thought each one would be in decreasing alcohol and drug use in the state. And each of the items we put forward had at least 2/3 of respondents indicating that they thought it would be an effective approach. The ones where we saw the greatest intensity of people feeling it would be very effective were making treatment for addiction more affordable and easily available, and connecting people trying to recover from addiction with support from other people like them. Each of those had at least 2 in 5 rating it very effective, and more than 4 in 5 rating it at least somewhat effective. Broad, if somewhat less intense, majorities also think that investing in prevention programs and sending people to treatment, not jail, for crimes that may be connected to alcohol or drug use would be effective solutions as well. Once again, we see a generally bipartisan agreement on the effectiveness of these approaches, with one exception. Solid majorities of Democrats, Independents, and Republicans look at those top 3 proposals and say, yes, I think each of these would be effective. Where we do see more of a partisan gap emerge is on the final item on the list, sending people to treatment, not jails or prisons, if they've committed a crime related to alcohol or drug use. That idea is embraced by 85% of Democrats. In fact, it's as strongly supported as any of the other policies we mentioned among Democratic respondents. and among independents at 70%, but support falls to less than half of Republicans, 46%, who back that idea. Geographically, the differences are far more modest than the differences we see by party. There are solid majorities that think all four of these policies would be effective approaches across all regions of the state. So that summarizes some of the key findings on these issues around health and well-being. I'll hand it over to Kyle to talk a little bit about some of the next steps that are coming up, and then we'll be happy to answer questions from the group.
Great. Thank you, Dave, and thank you, Lori, for walking us through a lot of information in a short amount of time. If your head is still processing through some of the numbers, some of the questions that you just saw flash on the slides ahead of you, there's still time to get your questions into the chat, and we'll have a conversation with Dave and Lori in just a moment to walk through the ones that we haven't been able to respond to in the chat already. So if you've been sitting on a question, sitting on a comment that you want to lift into the conversation, please do put that into the chat box now. We have mentioned earlier that for this year's Pulse poll, we're releasing the findings in more digestible chunks, focusing on topical themes to allow us to do a deeper dive on the crosstabs, the different patterns that we saw in the answers around specific topics that we heard from Coloradans that were top of mind for them. So previously we did a briefing focusing on cost of living and housing affordability issues. That information from that briefing is already available on the Colorado Pulse poll website. Today's briefing focused on what we heard related to mental health, substance use, and healthcare. All the information from today's briefing will also be available starting today on the Colorado Pulse poll website, available for you to look at there. And we have another sort of briefing coming up in a couple of weeks on June 22nd from 10 to 11:30, where we'll do a walkthrough of all of the questions, everything that we asked about, everything that we heard from Coloradans with some additional information. So feel free to register for that briefing on June 22nd. And we're also doing a Spanish language briefing, going through the poll results in Spanish language for folks who would prefer to absorb the information in Spanish on June 23rd as well. I do want to mention that we've created a number of ways of looking at this data that are available now on the Pulse poll website for you to look through. And I want to highlight in particular the partner toolkit section of that website, which has ways that you can sort of package, share this information within your organization, within your networks to drive conversations you want to have to look deeper at the results today. So now, Dave, you could go ahead and take down the slide, and we get to what is my favorite part of these briefings, which is I get to sound really smart by reading out the questions that our audience asks in the chat as well. So we're going to move to that section of our briefing today. So we get to have a conversation with the researchers behind all of this data that you just heard right now. And please do continue to put your questions into the chat. We're keeping an eye on that chat box. But the first one I'll lift up came from Renata Hill. And Renata wrote, "Health is health regardless of political affiliation. What's our philosophy in categorizing, then reaching out to residents based on their politics? And what about residents who are not registered voters?"
Well, I can speak to it from the perspective of the research, and Kyle, perhaps you can speak to it from the perspective of the foundation and the outreach work that you do. Absolutely, the health risks do not know any party lines, and they affect Coloradans regardless of their political ideology. But as we saw in a number of the slides, the responses to potential policy solutions to try to help with improving health and well-being in Colorado, there are partisan differences, as there are on many other questions. And so for us to understand the differing patterns of support among Coloradans and how ideas might work their way through the political and policy process, we feel it's important to recognize and understand those differences. As we saw in many of these slides, the partisan differences are greater than any demographic or geographic differences in terms of reactions to these policies. We do include people who are not registered to vote in the survey. We don't highlight them in the slide simply because those folks have a variety of different political ideologies, and so it doesn't sort of represent the same spectrum that it does when we look at the registered voters. But the perspectives of all Coloradans, whether or not they're registered to vote, are reflected in all the other data that we share.
Yeah, thank you for that, Dave. And I'll just add, from the Health Foundation's perspective, one of the ways that's really important to us as we built out and designed and thought about this survey as an act of listening to people in our state, that makes this poll different from many other polls that are conducted in Colorado or other places is that we deliberately try to come up with a sample of all adults in our state, whether they are registered to vote or not, whereas many other political polls that you'll see reported in the press or in other places focus on sampling and trying to predict the results of elections. So they really focus in on the folks who are most likely to vote, people who are registered to vote, and exclude adults who may not be registered to vote. So that is one way where the data set that we have is broader and hopefully more representative of everybody in our state as well. So that's an important thing for us as we think about designing the survey that is true this year, but then also true for the past years that we've conducted polls as well. The next question that we have in the chat is about the section of the data in which we looked at the questions where we asked Coloradans about whether or not they were worried about something. And when we were asking questions about expressing worry, is there a way to distinguish whether respondents were worried about themselves or their families or other people that they are close to or know personally? Or when we were talking about the reporting data on expressing worries, was that about worry for the state in general? And Lori, I think you addressed this in the chat already.
Yeah, I think that was related to the question where we asked them whether they were worried that they or someone else in their household would be without health insurance coverage. That's the one where we use the word worried specifically. So we aren't distinguishing between themselves and then other potential members of the household, because obviously that can bleed into their concerns as well. But then when we talk about problems and the very beginning questions that we asked about, we were asking the people to tell us how big a problem those were for the entire state of Colorado. So we do tend to see a relationship between people being feeling things are a problem for the state if they are experiencing them themselves. And so we know that those things can be related. But certainly people can look at something and have a broader concern about it for the entire state without it being something that personally affects them. Hopefully that's not too obtuse in terms of explaining that.
Thanks, Lori. And one of the other things I'll highlight about the way that we've structured all of these slides, and then also the other ways in which this data is available on the Pulse website, is you can actually refer back to the wording of the questions that people are responding to as you look at the data. So you can see sort of like, as the data is reported out to you, what was the actual question that we invited Coloradans to respond to, where we're drawing that data from. So you can really look at the specific wording of, are we asking about a personal experience, an experience that you or someone you know may have experienced, or is this something that we're asking about in terms of the state in general? And we do ask about all three of those things across the questions that we reported on today. So we do try to make that transparent to you about how those questions were worded so that you can interpret them correctly. One of the other questions that we got into the chat was about the findings that we had this year, that there had been an increase compared to last year's results in the total number of people in our state who had postponed medical or dental care in the last 12 months. And there was a curiosity about, is there any sense of why more people postpone care than they did last summer? Is it primarily worry about their finances? Or are there any other clues as we analyze that data from that question that can give us some sense of who those people are and some of the things that might have been driving that decision to postpone medical or dental care?
Yeah, I think, well, unfortunately, it'd be awesome if we could keep people on the phone forever or keep them online forever and ask them follow-ups for all of these. Unfortunately, we don't. We can only take so much of their time. But, we did draw some relationship to other questions. Obviously, those who were uninsured or who were worried about losing their insurance were more apt to say that they had postponed care. So clearly there's a relationship there with their health insurance coverage or the stability of that coverage. But we also saw a relationship to some other aspects, like concern about treatment along racial or ethnic lines was something where we saw a fairly strong relationship. And then clearly those people that are experiencing insecurity economically, those who had skipped meals, who were sort of engaging in other coping mechanisms due to the rising cost of living, were also more likely to postpone medical or dental care. So I think we can see that it's likely being driven by some of these cost concerns that we know are increasing, but potentially other factors are playing in as well. And hopefully we'll get to dig in a little deeper in future surveys in future years.
Thanks, Lori. Dave, I think this next question relates to a section that you covered around mental health and well-being, where the top line was, more than 60% of the overall sample reported experiencing mental health concerns of some kind in the last year. And we had someone put in the chat that they were surprised that 36% of Coloradans responded that they hadn't had mental health concerns in the last year. And we spent a lot of time digging into the crosstabs and reporting out about the 60% who said that they had experienced those things. Is there anything that struck you in terms of what we know about who the 36% are that said that they hadn't had mental health concerns in the last year? Who are those Coloradans? What do we know about them?
So I think there's a couple of things to keep in mind in considering that. The first is that, what we are measuring here is people who are willing to acknowledge to us that they experienced mental health strain. And so I would imagine it is highly likely that more than 61% of Coloradans felt such strain, but there may be some who don't acknowledge that to themselves or don't want to tell a pollster that they felt that way. So it's entirely possible that the numbers are even higher than what we see here. The fact that we start with 61% who say, yes, I absolutely have experienced that, I think does speak to how widespread the challenges are in this area, but it's possible they could be even higher. That said, when we look at those who were least likely to report having experienced this kind of mental health strain, it was the converse of the groups that we highlighted as the ones who were most likely to have done so. It is more affluent, older, whiter, heterosexual Coloradans are the ones that are less likely to say that they have experienced mental health strain. Although I should note, among virtually every subgroup in the survey, it was a majority or close to it who said that they had experienced it. So these are differences in degree. There's a high degree of sort of common experience here among most subgroups of the state's population where people have felt these strains.
Yeah, and we've seen this in years past too. I mean, just to give you one number, it was 61% of those 65 and older said they had not experienced that strain. So again, it may be that they don't want to say that they have, or that there's a societal concern about admitting that. That is somewhat different. We also saw a partisan distinction as well. So, some of this could very well be related to not wanting to indicate that.
Thanks, Dave and Lori. One of the other questions that we got in the chat on the topic of mental health and well-being was about children and youth in our state. So the survey was conducted among adults in Colorado, but correct me if I'm wrong, I don't believe we asked any questions this year asking adults to reflect on experiences of children in their lives. But I do want to lift up that in last year's survey, the 2021 Pulse survey, we did have a substantial section of questions that we did ask of parents or guardians of children about their concerns about mental health experiences that their children may have been having. So David, Lori, not to put you on the spot about a year's worth of data in hindsight and all that, it wasn't included on this year's poll, but we did cover that last year in 2021. And if there's anything that you remember striking you from those questions last year, go ahead and mention that now.
Yeah, I'm just actually pulling up that data right now, Kyle. So give me just a minute and I should be able to speak to that. There definitely were expressions of concern about children being impacted by some of these same mental health challenges in last year's survey.
So we asked parents in the last 12 months, have their children experienced anything the following? And we asked them about increased mental health strains such as anxiety, loneliness, or stress. We had half of parents indicating that their children had experienced that. Of course, again, that could have some of the biases we just talked about, and it could also be that kids might be experiencing mental strain and not telling their parents. So, there's a number of factors that go into these issues. But we also asked about how difficulty building or maintaining friendships, and that was at 39% that indicated that. So yeah, definitely some concerns that we saw last year that are that we didn't get the chance to ask about again and repeat this time.
Yeah, and folks have asked about, the data from different years and trends over time in a variety of different ways in today's conversation. So as I mentioned at the beginning, we're now in our third year of Pulse. It's a tough decision every year to get us down to a reasonable number of questions we can ask Coloradans on each year's survey. So Lori said, as much as we would like to have an hours-long conversation with folks, we do want to be respectful of their time. So we do have a handful of questions that we've repeated in each of the 3 years we've done Pulse, and we tried to lift up some of those trends over time data that we have from those questions as well. But we do ask slightly different questions every year. I will say, though, that for things that we asked last year, but not this year, all of that stuff is still archived on the Pulse website. So that section where we did dive into adults' perceptions of mental health for children in their lives in 2021, you can find the information and the reports of what we heard last year in 2021 on the Pulse website as well. One of the other questions that we got from someone on the call today was about disaggregated data concerning Asian American, Pacific Islander, and Native Hawaiians from Coloradans, because that's a relatively rare population to have represented and included in our state and quantitative data set like Pulse. I do remember that we asked a follow-up question of any respondent who reported an AAPI identity or ethnicity to disaggregate that a little bit, but once we get into the disaggregated, what specific ethnicity are you, we get to relatively small numbers within those. We didn't report that in today's look at the data, but there will be a way to look at that in the full data release we'll be releasing in a couple of weeks. But Dave or Lori, any other notes about the potential for disaggregating that data for AAPI Coloradans?
Yeah, you put your finger on the challenge, Kyle. Among those who identified as AAPI, we had a follow-up question asking for a more detailed identification of their ethnic or national background, and no more than 1 in 5 AAPI respondents chose any one of the subgroup categories we presented, which means that if we disaggregate the data, the subsamples are just really, really small, too small for us to do meaningful comparative analysis. It's just a challenge in a state like this where the AAPI population is relatively small as a share of the whole state. And certainly would be worth a more robust and separate research effort to explore some of those differences, but it's just hard for us to drill down to that level of detail in Pulse.
Yep, and Jace just put into the chat a link to the Pulse website where if you're really interested in the guts of the methodology of how we conduct Pulse every year, frequently asked questions that really get to the heart of some of these things that you're wondering about as well. I know that we also got a question in the chat about the languages that are available to people to participate in the poll. And we mentioned that we conduct the poll in both English and Spanish, but that's only 2 of the languages that are spoken in Colorado as well. So I do want to acknowledge that there are other languages that are spoken in Colorado, but it was beyond our means for this year's Pulse poll to conduct the poll or the survey in languages other than English and Spanish. But that is something that we're taking a look at in future years as well, about the potential, the feasibility of doing that so that we're able to have as inclusive a sort of sampling of folks in our state as possible. One other informational question that we got in the chat was, we highlighted lots of crosstab data about the experiences of LGBTQ Coloradans in today's briefing. The question in the chat was, what proportion of the overall sample reported being LGBTQ, and how many, what was the N for the LGBTQ sample for this year's survey? Dave, it looks like you're talking into the mute.
Yeah, it was about 10% of the overall sample that identified as LGBTQ. So that's enough for us to analyze them as a distinct subgroup. And again, that's something that in surveys with smaller sample sizes is much tougher to do. Other surveys often don't ask for people to identify their status along those lines either. And so, this is a relatively robust data set that allows us to draw some of those comparisons.
One of the other sort of informational clarifications we got into the chat was, do we know what percentage of employed Coloradans or what percentage of respondents have insurances tied to employment, whether that was through themselves directly or their spouse?
Yeah, and I think that one was answered in the chat by my colleague Lucia. I believe it was 37% are insured directly through an employer and 10% through an employer's through a spouse's employer.
Thank you, Dave, and thank you, Lori, for your top quizzes on all of this data, your reflections on this year's data as well. I'm doing a quick scan through the chat, and it looks like we've covered most of the questions that we got. I'm just talking slowly now to make sure that there aren't any last-minute breaking ones that we haven't touched on yet. But I do want to thank everybody for joining the conversation today, and remind you, everything that you've seen today is available on the Colorado Pulse Poll website, plus lots of other ways of looking at the data that we presented today, plus the data on cost of living concerns, housing concerns that we reported a couple of weeks ago. And there will be another opportunity in 2 weeks where we'll be sharing out everything that we heard on this year's poll with some additional trend analysis, other topics that weren't covered in the previous briefing or this one, to give you the full picture of everything that we asked, everything that we heard from Coloradans in this year's Pulse Poll survey. So check back on that website, register for the additional briefings in both English or Spanish that we're putting on in a couple of weeks, and give us feedback about what kinds of looks at this data, what kinds of ways of packaging it, making sense of it are useful to you. We have a real commitment at the Colorado Health Foundation to transparency and how we conduct this poll. So we are transparent about every question that we ask, the methodology that we use to ask it, and we don't hide any of the top line data, any of the crosstab data. That's all available to you in a variety of different ways on the website. But we don't assume that that means that you'll have no questions as you dig through that. So we encourage you to contact us, either myself or Jace Woodrum, my partner in crime, our senior officer for public opinion insights and the mastermind behind this poll at the foundation, if you would like additional looks at the data, other things that would help you to make sense of what we heard from Coloradans this year. But thank you again for coming to today's briefing. We hope to see you again. And thank you to Dave, to Lori, and all of our other partners in the Colorado Pulse Poll. We appreciate you.
Thank you very much.